Okay, good morning, everyone, and thank you so much for joining us today for the launch of Building Better Beginnings in Maryland. By now, I'm sure everyone here is a Zoom guru and is probably,
Felicia,
yes,
I don't think everybody has joined us quite yet.
okay. So should we wait a second?
Yep,
Okay.
here we go.
Okay, we're going to give folks a few more minutes to join the webinar. In the meantime, you can take the poll before we get started. So we're going to wait a few more minutes. Hi, Thandar, how are you? And I see that there is an echo, so we'll definitely make sure to take care of that. Thank you for letting us know. Perfect. Good morning, good morning. And Dr. Salmon, we're going to move you quickly to an attendee, but you'll still be on. Same thing for Ms. McFadden.
Okay, can you guys hear me?
Yes.
Okay.
And so now Gail's going to move you to attendee status. Perfect. All right, Gail, are we ready to get started?
We are.
Perfect. Gail, I think you have to mute. Okay, perfect. Well, good morning, everyone, and thank you so much for joining us today for the launch of Building Better Beginnings in Maryland. By now, I'm sure everyone here is a Zoom guru, and you're probably feeling a sense of Zoom fatigue. So to that end, we're going to make sure that this power hour will give you the information so you can better understand why this Prenatal to 3 collaborative exists, who is involved, and how you can support the efforts. But before we begin, there are a few housekeeping points that I need to cover. First, if you have not completed the poll upon entering the meeting, I ask that you do so now. We really want to get an understanding of who's here today with us. Also, I want to let you know that this event will be recorded for those who can't join us live today. Today's launch is a webinar. So that means you'll be able to see me and the other panelists, but we won't be able to see you. So if you have a question, please use the Q&A feature so we can follow up with you after the event. If you're a social media user, we'll be placing a link to a social media toolkit in the chat box. You can use this toolkit to let your followers know that the event is happening now and also to orient them to Building Better Beginnings. Building Better Beginnings is a bit of a mouthful, so you'll hear me refer to it as B3 from time to time as well. So before we officially get started, let's see who joined us today. So we want to have our Maryland Family Network Tech, Gail. Could you share the results with us, please, to see who's here? Okay, we have parents, we have some advocates, some teachers, direct service providers. We have a business stakeholder, that's exciting, and medical providers. We have several program administrators and government workers and some researchers. So we have representation from all of the categories here. So that's amazing. And I think that we'll have something that you all can take that you will find interesting. So we're going to close that out. And now we're ready to get started to share the good news. What you're seeing now is a snapshot of what our time together will look like. So we'll first hear from Andrea Palmer, Pritzker Children's Initiative Program Manager. We'll view a quick video that provides an overview of B3. I'll speak briefly about the path to this day. And then we'll hear from our state legislators, President of the Senate, Bill Ferguson, and Speaker of the House, Adrian Jones, and their support of B3. Followed by a live panel discussion with Dr. Karen Salmon from the Maryland State Department of Education, Secretary Lourdes Padilla of the Department of Human Services, and Courtney McFadden, Deputy Director of the Prevention and Health Promotion Administration at the Maryland Department of Health. After the panel, we'll hear from a Maryland parent, Michelle Simpson Gray, and learn about her experience accessing some of Maryland's prenatal to 3 programming. And finally, we'll engage in a brief chat and you'll share how you can get involved. So we're going to get ready and get started with Andrea Palmer, who is the Pritzker Children's Initiative Program Manager. She'll provide an overview of the Pritzker Children's Initiative and Maryland's role in this nationwide prenatal to 3 initiative. Before Andrea begins, the Key Leaders team wants to thank and acknowledge the general funding from the Pritzker Children's Initiative by way of the JB and MK Pritzker Family Foundation to fund Building Better Beginnings, and for your guidance and support throughout this competitive process. So without further ado, I'm going to turn the program over to Andrea.
Thank you. Good morning. Good morning, and thank you, Felicia, and congratulations to the Maryland team on reaching this exciting milestone. As Felicia mentioned, I'm Andrea Palmer, Program Manager with the Pritzker Children's Initiative. The Pritzker Children's Initiative has a vision that every child will enter kindergarten ready to learn. We know that to achieve this vision, we have to center our efforts on the prenatal to age 3 timeframe, which according to brain science is the most critical window of opportunity for brain development. The research also tells us that there are vast disparities in school readiness and ultimately educational outcomes for infants and toddlers of color and those who are poorly resourced. Next slide. To achieve our vision, we have a big, hairy, audacious goal, which we lovingly refer to as our BHAG, of at least 1 million infants and toddlers and their families having equitable access to high quality services and supports by 2023. Next slide. To accomplish this goal, we are partnering with 20 states and 10 communities to support cross-sector collaboratives aimed at identifying the strategies that will assure that infants and toddlers are born as healthy as possible, that their families are supported, and that infants and toddlers have access to high quality care and education. Next slide. Because we are laser focused on our BHAG, we have asked our state and community partners to quantify the impact of their efforts and to demonstrate that they have reached 25% of their families most at risk for poor outcomes by 2023 and 50% by 2025. Next slide. We are thrilled that Maryland is one of our partners in this work. Thank you again, Felicia, for inviting me to participate in this event.
Thank you so much, Andrea. We really appreciate your continued support and leadership throughout this journey. Next, I'd like to play a quick 1-minute video that provides an overview of B3, who's involved in the collaborative, and what we're working to accomplish. In the midst of this COVID-19 pandemic, it is very clear that a commitment to the prenatal to 3 community by intentionally unearthing inequities within our state is necessary for the well-being of Maryland's families. Let's start the video.
Building better beginnings. Our goal is to see that all expectant families and those with children prenatal to age 3 in Maryland thrive. Organizations and agencies from around Maryland have come together to ensure that our children, our families, and our state have a solid future. They're supporting Building Better Beginnings because they want all pregnant women, infants, and toddlers to be healthy and thrive. Building Better Beginnings has 4 main goals and objectives: good health and healthy beginnings, strong families and family supports, positive early care and learning experiences, and systems and infrastructure development. Supporting children early saves money. It's an investment, and it's the right thing to do. Will you help ensure that Maryland's children are healthy, educated, and ready for the future that awaits them? Because equity begins with you.
I hope you all enjoyed that video. So next, I want to talk a little bit about how we got here today. So the Building Better Beginnings journey began a little over a year ago with a planning grant to support the development of statewide strategies to improve programs for 0 to 3-year-olds. That later resulted in a comprehensive proposal that was submitted in the winter. Several working groups later, of which many of you participated in, a proposal was drafted, and with the formation of its key leaders group, Maryland Family Network and the Maryland State Department of Education was awarded a coveted Pritzker Children's Initiative grant this summer. We know that equity begins before a child is born, and B3's vision is inclusive of expectant families and those with children up to age 3 to be in a position to thrive. To this end, we aim to remove financial and structural barriers that prevent vulnerable populations from accessing the high-quality programs and services they need and deserve. Our mission is to establish, enhance, and expand high-quality programs and services for vulnerable, expectant families and those with children across Maryland, young children across Maryland. We will also increase the awareness of the critical importance of early life experiences in achieving lifelong health and well-being. There are approximately 221,000 infants and toddlers in Maryland. Building Better Beginnings is a decisive step towards securing the high-quality services and programs needed to ensure the health and development of all of these children. That's why we're intentional about advancing equity and removing barriers. As you can see, having an equity lens that we will keep on and not remove is a key value for Maryland's prenatal to 3 system as a defining feature of its high-quality programs. Additionally, B3 intentionally targets services to our state's most vulnerable population with a keen focus on policy change that promotes equity and equitable implementation. This takes us to our 4 key areas of implementation, or simply stated, the goals of the grant. Number 1, healthy beginnings for pregnant women, infants, and toddlers. 2, strong families that are supported and supportive of their child's development. 3, positive early learning environments for children, practitioners, and their parents. And 4, systems and infrastructure that support a sustainable continuum of care. While I won't review these in great detail, at the end of today's event, we will announce a subsequent opportunity that will take a deeper dive into the goals and objectives of B3. I recognize that I'm speaking to an audience of prenatal to 3 stakeholders who in some way are connected to Maryland's pregnant women, infants, and toddlers. I'll refer to us as the usual suspects. However, sometimes we tend to leave out our state legislators when we think about prenatal to 3 advocacy, programs, and services. The reality is, our state legislators are the ones who champion and support our work through enacting legislation. These policies that are enacted allow us to do the work that we do day to day. With that said, I'm so pleased to announce that our state legislators recognize the need to invest in prenatal to 3 programming and fully support Building Better Beginnings. We are thrilled that the President of the Senate, Bill Ferguson, and Speaker of the House, Adrian Jones, are champions of our community. They were unable to join us in person this morning, but they know the importance of investing in our state's most vulnerable pregnant women, infants, and toddlers. So they recorded videos to highlight their accomplishments and ongoing commitment to early childhood, and why they believe investing in prenatal to 3 programs and promoting policies that support young children and families are crucial to Maryland's future. With that being said, let's hear from President of the Senate, Bill Ferguson, directly followed by Speaker of the House, Adrian Jones.
Welcome, Building Better Beginnings Coalition. I am so excited to know that this coalition has formed to focus on one of the issues that I believe is the most important for the state of Maryland to address in the years ahead. This is something that has become personally a true mission for me when I first came into the Senate and throughout, and now having the honor of serving as the presiding officer of the Maryland Senate, figuring out how we can create better early childhood education opportunities for all of our state's young people is an absolutely essential priority. It started when I was in the classroom. I was a teacher in Baltimore City, and I taught high school, 9th, 10th, and 11th graders, U.S. history and U.S. government, and heard the stories of a number of my students and their siblings and the experiences that they had had and the inequitable opportunities that were made available to them. It was something that hit me very, very personally, something as having come from a great deal of privilege where I feel very fortunate to the opportunities that I had. It wasn't until I was in the classroom that I really began to understand the differentiated opportunities that we have here in this great state, but that exist right now today. It's from that experience in the classroom and seeing those inequitable opportunities that drove me to run for office in 2010. I fundamentally believe that if we truly are going to create a thriving economy here in the state of Maryland, we have got to focus on investing in young people's education to ensure that their long-term opportunities meet their fullest potential. That starts at the earliest ages. And what we've seen from brain science, from economic data, when we get it right early, the long-term outcomes are so much better. You either pay it now or you pay it later. And I just fundamentally believe that if we can put the resources at the early end of the spectrum, that is where we will start to see a much more equitable and thriving state of Maryland. But this work is really hard. It's really tough, and it's not something that one bill or one law will ever accomplish. Let's go back in time a little bit. My early childhood education legislative experience started back in 2013. In fact, it was even a little bit before that when we were talking about gambling, when we were trying to think about how we were going to use the funds for for the table games expansion. I fought on the Senate floor to say that all of our casino money that comes in, that in order to make sure that it was additive, that we should make sure that the Education Trust Fund funded expanded early childhood education. We finally were able to add that to the bill. In 2013, we came back with the Race to the Tots legislation. This was a competition to try and get local jurisdictions to put money into expansion opportunities so that we could get more high-quality seats available to the young people that needed them the most. In 2014, we came back with the pre-K expansion grant. This was to work with our federal partners, in which Maryland was very successful then under the Obama administration to use dollars flexibly to make sure that our highest need young people, those 3s and 4s, and even earlier, had the opportunity to be able to access a high quality early childhood education experience. Move forward a few more years, and as we started to get our early learning councils really moving and the recommendations were coming, we found additional ways to make sure that the sector was prepared. We passed a bill in 2016 to focus on the professional development of our educators in the early childhood education space because we know there's a huge workforce demand. Fast forward to this year where we passed the blueprint for Maryland's future. The work that we're doing around early childhood education quality expansion was built on this idea that if we get to young people earlier, we'll have a better long-term result. We've also looked at the way that healthcare intersects with early childhood education. And so I worked with the Maryland Family Network and a number of the partners who are a part of this amazing coalition to create the Thrive by 3 Fund so that we could focus on mothers and families and ensure that there is the access to the healthcare services that we know start lives in the most effective and productive ways. Finally, we know that it's not just about access to classroom space or to education. It's also about the policies for our workforce. In 2018, I was able to work with this coalition or a number of individuals in the coalition to pass paid family leave for state employees. This was a big deal. We said that it is absolutely essential that caring parents that work for the state would have the ability to be home with their children for those first few months that you never, ever get back. It was a bill that I will say is one of my proudest moments and that I still today probably get the best constituent messages from state employees who found out that I was a part of this effort and just write thank you for having that special time with their infants at those early brain developing stages. And it's just something I'm so proud to have been a part of. Finally, I said at the beginning, but I think it's important to end with the fact that this is personal. I knew that early childhood education was important, but it was when Caleb and Cora were born, who are now 8 and 6, that it really became so clear to me how important those early years are. To see my son and daughter's growth in those early few years just was the most convincing piece of data I ever could have needed to know that this is the right space to be fighting for in the years ahead. And so I want to thank you. Thank you for being a part of this coalition. Thank you for the work that we're going to do together. The Building Better Beginnings Coalition is sorely needed. You are in the right space. Let's do some amazing work in the years ahead.
Wow, what a powerful video. I'm going to quickly transition us to hear from Speaker of the House Jones, what she has to say about B3.
Hi, I'm Speaker Adrienne Jones, and I'm pleased to join the Maryland Family Network and the Maryland State Department of Education to help launch Building Better Beginnings. This program is part of a larger effort for public and private agencies and organizations to come together and support Maryland's young children and their families. As Speaker of the Maryland House of Delegates, I am working to ensure that the state is an active partner in supporting our most vulnerable populations, particularly women and families with small children. Passing the blueprint for Maryland's future was a vital part of achieving this goal. The blueprint makes critical investments in Maryland's early childhood, primary, and secondary education system so every child can receive a world-class education, starting with our youngest students. This transformative bill prioritizes early support and interventions for young children and their families. It expands access to high-quality full-day pre-K for all 3-year-olds and most 4-year-olds. And it provides funds to create more access to Judy Centers and other early education programs. The pandemic exposed deep health, economic, and education inequalities in our most vulnerable communities. Next session, we will address many of these disparities with a racial and economic justice plan that also works to support pregnant women and young children. This includes lowering the maternal mortality rate for Black women, expanding fresh food options, and creating more economic mobility in historically disenfranchised communities. As a mother and now a grandmother, I know that our very young children and their families need the most support. These initiatives are just a few ways we're working at the state level to provide assistance to families that need it most. Thank you, Maryland Family Network and MSDE, for demonstrating how state and local agencies, research institutions, nonprofit organizations, and businesses can come together to help solve our toughest issues. I'm proud to be a partner in this work and look forward to building better communities together.
Wow. So I just want to reiterate President Ferguson's message that this is the right space to fight for. And Speaker Jones's final word that we all can come together to help solve our state's toughest challenges and to build strong communities, starting with families. These salient points leads us to our next segment of the webinar, the panel discussion with state agency leaders. So although there are several organizations invested in B3's work, we are joined by the leaders of state agencies who pledged their initial support for the grant. I am so pleased to welcome Dr. Karen Salmon, Superintendent of the Maryland State Department of Education. Thank you for joining us. Lourdes Padilla, Secretary of the Maryland Department of Human Services. And Courtney McFadden, Deputy Director of the Prevention and Health Promotion Administration at the Maryland Department of Health. Once again, thank you to this dynamic group of women who have led and continue to lead the charge with their agency's investment in prenatal to 3 programs, So let's get started with our panel discussion. My questions are directed to everyone and you can answer in no particular order. So let's get started. Could you tell us, why is it important for your agency to invest in prenatal to 3 programs? And make sure you take yourself off mute when you respond.
So I guess I'll start. And good morning, Felicia and everyone else. It's so nice to join you today for this very important webinar. Since I've been state superintendent, I have been very proactive in promoting early childhood education, starting prenatally. And it's something we've carried through our whole department. And we're very fortunate to have a very dedicated and talented assistant state superintendent for early childhood, and that's Stephen Hicks. And Stephen has done a great job in promoting this work. And I would have to say that the 3.5 years that I sat on the Kerwin Commission, if you go back and look at the record, I probably said about at least 50 times, we need to fund early childhood education. That needs to be the very first thing we do, because we know from the research, we know from the Head Start programs in the 60s, how that impacted our students and our former students and our children's children. So we are right behind this initiative, and we are so fortunate to be associated with this grant. And I am so excited about the work that's going to come ahead. So I think it's essential that the State Department is involved in a very proactive way. We will be behind all of you in all of this work. And you know, the investments we make now in our students are going to pay off in the future. So I'm very excited about working with my fellow colleagues here. And so I'll stop and let someone else talk.
Okay, thank you. And Stephen Hicks is one of our key leaders. Just wanted to plug that as well.
Good morning. I'm Secretary Padilla. I guess I'll go next. At the Maryland Department of Human Services, our focus is on building the economic security and well-being of the whole family. So we really want to start looking at the whole family. And the prenatal to 3 time period is a critical time for children and their parents. In child welfare, children aged 3 and under are at the greatest risk of maltreatment. This is really the time when connecting parents to support can have the greatest impact on preventing harm, reducing family stressors, and keeping families together. And we're also learning more about the changes to parents' brains from moms and dads when they have very young children. I remember when I had my first child, the experience that I went through and how my brain was functioning, and you know, it's such a big change. But we're seeing evidence that support that 2-generation approaches to workforce development. It really works when you connect that young parent and provide the services to the children and help them be successful and you know, searching a job, mastering the skill of being a new parent with a baby or a toddler, and also going to work. And you know, through this grant, we're going to be helping those parents and identifying the services that are needed to get them to be successful in their employment participation. When we design programs and services with the whole family in mind, we have more successful programs and services. So that's one of a few reasons why it is very important for the Department of Human Services to invest in this program. Thank you so much.
Thank you. Oh, let's see, Courtney, we're having an issue with your audio. Not right now. We can hold for a second.
Can you hear me now?
Yes.
Okay, so thank you. The vision of the Department of Health is lifelong health and wellness. And so nowhere is that more important than the prenatal to 3 age group, where we can ensure a healthy beginning by providing tools and support to ensure that families and children get a strong start. I think one of the things that really stands out to me, the pandemic has really unmasked the consequences of inequities that start in this time period. In addition to the social injustice that we're seeing that has been ongoing. I'm sorry, that's my coworker who's in that prenatal age range. But I think, it's really important to start at the basis to try to bridge the gap where there are inequities so that children, because as we know, this affects them throughout their life course into adulthood, and where we have poor outcomes, health outcomes, where we have people being, groups in populations being disproportionately impacted by disease. And so this is really important. It's an important start for the families, as everyone has said. And I'm really happy that there's coordination with the three very integral agencies that impact families during this age group.
Thank you so much. I think listening to everyone's investment in the prenatal to 3 space is really important. And that kind of leads me to my next question. I think the attendees would like to know, what programs would you like us, the attendees in the early childhood community, to know about that either that already exists or you're planning to launch shortly?
Well, I'll start again. I think we're going to get into this routine. I can see it now. But at MSDE, we have a lot of programs. Our Division for Early Childhood actually licensed over 7,600 childcare programs and distributes childcare scholarships to over 20,000 children born into low-income families. We also oversee Head Start. We also take care of the family support centers, and in the fiscal year 21 budget, the governor allocated funds, so we were able to have 6 more centers, and these centers are awesome, and many of you are involved out there in these centers. I commend all of you for your excellent work with families. They're just a hub of learning and support for families, and we're very fortunate to have that model here in Maryland. We also have a lot of projects that we just started this year through our preschool development grants, birth through 5 funding, which is funding prenatal to age 3 projects across the state. And we're hoping to reach our most vulnerable families. In addition, we've provided professional development to about 4,000 early childhood teachers who work with babies and toddlers. This is very important. Professional development, continuing to refine our skills and what we do with families is a very important part of our work at MSDE. In addition, we also work very closely with the Maryland Infants and Toddler Program, which is overseen by our other division of early intervention and special education services. And we got an increase again in our ability to provide for this program by $2 million for these critical services to our most vulnerable children and babies that may have disabilities. So we're right in the middle of providing as much as we can, but hopefully this work ahead will give us more opportunities to serve the younger families and the babies and the toddlers in our state. Thank you.
Wow. I even learned more about what MSDE is doing. Wow. That's all I can say. Secretary Padilla?
Absolutely, very exciting. We have a number of evidence-based prevention-focused programs offered to families with children 3 and under. For example, parent-child interaction therapy is a program for children ages 2 to 7 and the parents or caregivers. And the purpose is to increase positive parenting and improve the quality of the parent-child relationship. I also want to highlight the sobriety, treatment, and recovery team that we all know as START model. This intervention is an interagency collaboration designed for families with parental substance use and children up to age 5. The goal of START is to keep children safe and prevent an out-of-home placement. And I'm sure you know, the Family First Prevention Services Act has presented a number of opportunities for the department to expand access to services that are evidence-based. The department, in collaboration with the Department of Health, looks to increase access to 2 home visiting models. Those are Health Families America and the nurse-family partnership. One of the goals of the Maryland's Family First Prevention Plan, which is approved, is to continue the work of transforming our child welfare system into a family support system. We're looking at many ways to connect parents and children to the whole range of support that they need to remain safely together, including benefits, workforce development, education, healthcare, and more. Thank you.
Wow. Maryland is really, I just hope the attendees can kind of glean from this discussion that Maryland definitely has an interest and has demonstrated that they are committed to the prenatal to three community. I definitely want to give Ms. McFadden an opportunity to chime in on that question, but I think there is definitely a theme of dedication to the prenatal to three space.
Yeah, I agree with you. And, you know, the Department of Health is a big conglomerate. You know, obviously we have a delivery system that consists of public and private hospitals, local health departments, and a lot of community partners. We have Medicaid housed within the Department of Health. And so Medicaid is obviously serves as an integral provider for those in that age group. But I kind of want to focus on really specifically some of the other public health services that we have available for this age population. And so Senator Ferguson mentioned the Thrive by 3 program that is administered by the Department of Health, and it's intended to provide care coordination for the most vulnerable populations. And so we're happy to be coordinating that. We also obviously have the home visiting program that's federally funded through HRSA, and we use data to drive where those programs are implemented, which jurisdictions are implemented. And so using data to say where are our families most impacted by poor education or crime, poverty, other health metrics that really try to get us to where the populations that we need to be in throughout the state. And then we also, in the Maternal Child Health Bureau at the department, we really are trying to be innovative with how we respond to the emerging needs of the population. So we are really focused, we're developing a maternal health strategic plan that will have a huge focus on racial equity. As you know, disparities exist in infant mortality and in maternal mortality. They're intertwined. And so we really want to try to work with stakeholders, other state agencies, community folks to help drive where we put our efforts and our resources. And then also other programs that respond to emerging needs like SBIRT. So making sure there are processes in place to screen for substance use in different programs. We're trying to stand that up in family planning programs right now. Our family planning programs provide services to women and families throughout the state, adolescents, and then also we have a focus on breastfeeding and other family health services like immunizations. And so we really do all the vital traditional public health kind of stuff, but also really want to try to be innovative in responding to the population needs.
Thank you all so much for answering that question. I did see some questions come through in the chat. If you have specific questions for either myself or the panelists, if you could put those questions in the Q&A feature, that way we won't miss them and we'll be sure to follow up with you directly after the event. So I did see a question or two come in while you all were speaking. So I think now we can kind of get into sort of an imaginative question. Because you all have definitely demonstrated that your agencies are invested in the prenatal to 3 space. But if someone gave you a magic wand, what programs or services would you make available for families and children from birth to age 3 in Maryland?
Well, I would really like to have a magic wand right now. It would be very helpful in this incredible time we're going through with the pandemic and trying to get our children back in school for some in-person instruction. And I just want to take a second to commend our early childhood community for the work they've done since March in providing childcare across the state for our children and doing it so well and so safely. So I want to just say thank you to all of them. They are real heroes in this initiative. As far as birth to 3, I'd like to get us to the point where that I use this story all the time about the African tribe that greets everyone, no matter what part of the day it is, with the phrase, "And how are the children?" I want us to think in this country, in this state, about children first, and their needs, and put everything else aside. And I'm not sure we always are able to do that, but that's, in my opinion, what needs to happen, because it is an investment in their lives and in the future of our state and country. And because of that, I really think we need more federal investment in early childhood education. I mean, we're so behind other countries that have had so many programs, unique programs for years and years, for at least 30 years. And here we're now realizing how impactful these programs are. And I really think we need some more federal investment so that all families can have the ability to receive services. Right now, we only have about 12% of our families able to receive the Early Head Start program. And that just needs to be tremendously expanded. And so my magic wand would make that number go up exponentially. I'd also like to see increased federal funding for childcare and the Maryland Infants and Toddlers program. I just think, especially now after the results of the pandemic and the impact on that industry, we need more federal support for those businesses in order to provide the services to our children and families. I just think that there has to be more federal investment, and I'm hopeful with maybe what might be ahead in terms of our future with the new president. Maybe we can see some of those efforts really come to fruition over the next 4 years.
Well, let me go ahead and hand you the wand right now, because I definitely agree with you. Looking at other countries and how they have embedded early childhood and prenatal to 3 care in their culture, you know, you see the outcomes in their infant mortality and maternal mortality rates, and how their children are doing academically. So I wish I had the magic wand. I would just kind of hand it to you right now.
Thank you.
Yeah, Secretary Padilla.
Thank you. It's not magic, right? It's our reality. But one thing we have long needed in Maryland is a more connected system. We have to end this information silos that we have. And we all know that when a parent seeks services for the child or for themselves, we should be asking them, what else do you need? What else do your whole family need? We know, we have the services, we have the information. Let's start asking them that question. We know that when parents are doing well, their children are better off. When children do well, their parents are better off, right? So our vision is in Maryland, where a parent searching for childcare or health insurance for the child would not only have the opportunity to do that, but could also receive workforce training, education, mental health, and housing support for themselves without having to go door to door, telling pieces of their family story to get what they need. So my magic wand request is connect. Let's end the silos. And when I speak about the silos, even though I made reference to Maryland, there are a lot of silos at the federal government level. And, you know, it's truly a barrier for us to be successful. So as Superintendent Salmon said, we're really looking forward to be able to work with the federal partners so they can also change some of their policies that would allow states to do more information sharing. Thank you.
Thank you.
Thank you. So I think for the health department, one of the things we're really interested in is trying to expand the availability of home visiting services. It's such a wonderful resource for families. And right now, we're certainly not meeting all of the families that we could be. And so one evidence-based home visiting service is called Family Connects. It services moms who deliver at any hospital. We currently have one pilot in the city, and we're planning one right now in Prince George's County. And the program is voluntary, of course, and a registered nurse does the home visits. And the unique thing about this program is that it would touch every family that delivers. And so, we like to say in the Maternal Child Health Bureau that our services really touch every Marylander, because we kind of do everything in between birth and the end. But having that connection at the delivery hospital, we think would really go a long way to extend our reach, to make sure we're touching even the most vulnerable of populations that are sometimes hard to reach. And so that would be my magic wand request.
Yeah, I'm listening to everyone speak, and a lot of what you all said is doable. And like Secretary Padilla said, it's not magic. And I think the work of B3 will definitely help us begin to break down those silos, rely on the research, what are the promising and best practices happening in other countries, and even within our nation. Being a part of this collaborative and being connected to the Pritzker Children's Initiative really helps us expand our network across the nation. So we're not just focused on what's happening in our state, but we're really learning from our peers. So that's another great part of being a part of this B3 collaborative. Now we're actually ready for our final question of the morning. And so I want all the panelists to respond. If anyone watching wants to know more about your agency's prenatal to 3 initiatives, how can they find out more information?
Well, I'll start. Obviously, our website is just packed full of links to click on and information. Certainly, we have people that would be willing to talk on the phone. We have phone numbers and live people to talk to when you call to get information. We put out a bi-weekly newsletter called Tuesday Tidbits, which is packed with information and a good way to find out about the activities that are going on. We also have quarterly Office of Child Care Advisory Council meetings and state intervention coordinating council meetings. And yesterday, we just had our quarterly early childhood I don't know if it was yesterday, my days are very mixed up, but we just had our quarterly early childhood advisory council meeting. And I just wanted to add one quick comment. I really believe what the secretary said is so important about the silos and the connections that we need to make. And I think that that is what this grant is going to help us do, is to really get our act together and make sure that we're serving families in the most demonstrative way that we can. And I also want to just comment on something that Courtney said about the home visits, which I think are so crucial, and also getting in when those babies are born in the hospital and even before with those mothers. Because even the mothers, and I can remember myself many years ago when I had my first baby, I needed all the help I could get. And I came from a very nurturing family and had a great mom who was a good resource to me, but I still felt that I needed help. And so I think just judging from that, everybody needs the support of others during this critical time to make sure that we're doing all that we can for our babies and their health. So I want to thank both Courtney and the secretary for their very cogent remarks today, and I've learned some things too, so thank you both.
I go next. They can visit the Department of Human Services website, dhs.maryland.gov. Under the services tab, we list services for families. I want to also take this opportunity to say and thank the many workers that I know have joined this meeting, because they're at the very front also providing services to the family and answering the questions on a day-to-day basis. With the MD Think system that we are developing, parents will be able to see programs that are available to their children in their area when they go to apply for programs for themselves. So I'm very optimistic that by partnering, as we discussed today, and by putting more information out to the parents, that we're on the right track. And the more communication, the more outreach that we do, the better we will be. Thank you so much for having me as a participant today.
So thank you, Dr. Salmon, for your comments, and Secretary Padilla. We're happy to be, again, collaborating with you. And I do just want to say, I have to echo some of the comments that you made. I really want to, high quality childcare services, being a mom of a 20-month-old and working from home. But even without that scenario, it's so crucial for the success of our families. And so I really hope that through this coordination, we can get that. And also, Secretary Padilla, that we also really believe the data sharing between state agencies is really, really crucial to help the experience that the family has, right? We don't want families to have to go to 3 different places or 4 different places to apply for programs and services. You know, they need help, and we want to try to really coordinate that effort and make it as seamless as possible and make sure people don't fall through the cracks. So I hope that we can achieve that through this collaboration. But to answer your question, most of our prenatal to 3 work outside of like the normal, healthcare delivery services are through our Maternal and Child Health Bureau. And I'm happy to provide our webpage and the link, which I think has a plethora of resources, specifically in our Maternal and Child Health Bureau, which administers our home visiting program. Our home visiting program also develops a monthly newsletter with news you can use and resources and links and news stories. So I invite all of you to go and check it out, and hopefully you'll find some helpful resources there. And you can also connect to anyone at the department if you need to speak to someone.
Well, thank you all. This kind of wraps up our panel. Thank you all for your time. Thank you all for your leadership and willing to engage and connect. And honestly, we just look forward to the ongoing collaboration. So at this time, we're going to wrap up our panel. Thank you once again. And so you're going to see our panelists kind of leave the screen one by one. And I'm going to see you later. I'm going to transition us. We are coming up on time, and I really want to get through the last part of this call today, well, this webinar today. Just quickly want to highlight some of the progress that the state has made since being awarded the grant in June of this year. Maryland Infants and Toddlers Program distributed an additional $2 million from the Early Childhood Enhancement Grant to local infants and toddler programs through their FY 2021 Consolidated Local Implementation Grant. These additional funds will address the disparity between the 38% increase in enrollment in the program and level funding for the next 10 years. Several new duty centers and family support centers will open in FY 21. And the Maryland Department of Health was awarded a maternal opioid misuse grant known as the MOM grant. This MOM initiative focuses on improving care for pregnant and postpartum Medicaid participants who are diagnosed with an opioid use disorder. And this program will launch in summer 21. So that's just a snapshot of some of the progress that has been made. But today we spent a great deal talking about why it's important to invest in prenatal to 3 programs in Maryland, and I think you get it. However, we've not yet heard from a parent and their perspective. I am so excited to introduce to you Mrs. Michelle Simpson-Gray, who is a mom of 3 and has benefited from some of the Maryland's prenatal to 3 programs and services. Let's meet Michelle very quickly.
My name is Michelle Simpson-Gray. I have 3 amazing kids. I have a 15-year-old son, a 6-year-old daughter, and a 4-year-old daughter. I was young when I first had my 15-year-old. I was actually 18 when I had him, so I had to become a parent quick. It's a struggle out here raising kids, and you can't provide for your kid if you don't have the right programs to reach out to. Infants and toddlers, they have helped me out tremendously. They have stuck by me through everything. I didn't get introduced until I had my daughter, my 6-year-old daughter. She ended up coming early. I had difficulties with her, and I actually almost lost her. So they have always been on top of their game when it came to helping my 6-year-old and my 4-year-old. My 4-year-old, she was with infants and toddlers too. She had a little bit of a speech delay. And after getting home visits from them. Somebody came out and seen her every week from infants and toddlers. And when she finished that, they said that she was actually above her language skills and she's only 4. So she's speaking like a 5 and 6-year-old. So, and I could tell that on a day-to-day basis because most times I think I'm talking to a 24-year-old. So the Parent Cafe was amazing. It was more than what I expected. I left there with finding new ways to tackle my day-to-day situations, my day-to-day struggles, my day-to-day schedules with my kids, with my family, with friends. So yeah, it was really good. But that's the beauty part about being at a parent cafe, because it's not like it's just one, it's many of them that you can attend, is new people that you can come in contact with, new stories that you can hear, is new advices that you can take into consideration with how to balance life, period. No matter if you're a parent, no matter if you're employee, grandmother, aunt, uncle, you can balance your life. You can find new tactics to tackle when it comes to balancing everything. The Judy Center, they have so many opportunities for parents. They hold play groups there. My 4-year-old and my 6-year-old daughters, they was in play group. In play group, they did so many activities. One of my favorite things that they have at the Judy Center is Cooking with Miss Karen. She teach us how to fix healthier meals. And with the healthier meals, I can learn how she make her healthy meal so then I can bring it home and make it for my own family. They also have food distributions. You bring home so much food. That also help at the end of the month, especially I'm raising a family of 5, so that really come in handy. Another favorite one that I've had that Miss Michelle introduced me to was a stress reliever workshop. That actually it helped me out so much. I was able to sit down, talk to other parents about what I go through on a day-to-day basis. So yeah, I really appreciate all the stuff that they do there. So actually WIC have helped me out also, because now I'm on the right path to knowing what healthy foods to give to them, how much to give them on a day-to-day basis, what not to give them. I would like lawmakers to know that I thank them for everything that they have done so far. I know it has been a challenge with getting so much signed to try and push forward to get the help that us as parents need. I think it's important for the state to invest in programs for pregnant moms and kids, because I think it will take a lot of stress off their backs. It will give them more opportunities to go for what they need, not for them, but for their family, for their kids. I would like to see more programs created that will have parents be able to have their kids in a stable and safe environment while they're at work. No matter the obstacles, and you're going to have plenty, like so many obstacles to the point you just ready to throw in a towel. Don't throw in a towel. Is more help out here than you know. It's so many programs that you can reach out to. All you have to do just go to them. All you have to do just get in contact with one person. If that person don't know, there's always another person. The main important thing is I'm not alone in this whole entire situation. Don't give up, keep pushing, keep reaching, live out your dreams, help your child live out their dreams or live out his or her dreams. And yeah, it's just don't give up. It's gonna be okay.
I'm not sure about you, but Miss Michelle's story truly resonated with me. It's stories like hers that drive the work of building better beginnings. And we're so grateful that she chose to share her story with us. I love how she said, don't throw in the towel, don't give up, and that it's going to be okay. With everything that's occurred in 2020, these are the messages that inspire. And we want the prenatal to 3 community, specifically parents, to know that there is help in our state. So as we near the end of today's event, we'd love to hear from you. Using the chat feature, I'd love for you to answer the following question in the chat. In 3 words, what excites you about building better beginnings? So please go ahead and type in 3 words, what excites you about B3. We're running up on time, and so I want to honor your time and I have a couple slides to get through. So keep typing in the chat and I'm going to keep on talking. So as I mentioned earlier, if you are interested in taking a deeper dive into the goals of building better beginnings, please sign up on our website to get alerts and updates so that you can sign up for the event that I have on the screen, where we're going to take a deeper dive into the goals and objectives. And so once that date is solidified, we will notify everyone who signed up for our listserv. So at this point, you may be wondering, how do I get involved? Well, I ask that you visit our website and sign up for our listserv. Our website will have more detailed information about the grant, our Blogging Better Beginnings page, which will feature the work of jurisdictions in Maryland that are implementing promising or best practices and opportunities to engage. We've placed the link in the chat for easy access. And to stay up to speed on everything that we're doing on social media, please follow us on Facebook and Twitter at B3 Maryland. As a growing body of statewide polling indicates, Marylanders want policies and programs that benefit very young children and their families. This includes paid family leave, access to quality childcare, and economic supports for families. Building Better Beginnings is committed to Maryland's families, and we will not rest until every child has an equitable path to success. And so that leads us to the thank yous. We want to thank Mrs. Simpson-Gray, our legislators, agency panelists, B3's key leaders, my Maryland Family Network colleagues, Doug Lent, Gail Gouillard, and Clinton McSherry, and everyone who's here today to launch Building Better Beginnings in Maryland. Remember, equity begins with you. Have a great day, and we'll be in touch. If you have questions, please type them in the Q&A, and I see the thank yous. Thank you so much for being here.